Let me show you Payment Options 2.0. The purpose of this little piece of software is to increase case acceptance in your office and also increase your collections from patients. So let me describe how this works for you. A recent article in the ADA Journal showed that patients are way more afraid of the cost of dentistry than they are of the dentistry itself. Okay, cost is the number one thing that keeps patients from having treatment done. We don't wave the forceps in front of the patient when we're trying to get them to agree to treatment. So don't give them this thing, this detailed breakdown of each individual line item, how much it costs, how much the insurance is going to pay. You know, this focuses the patient on the wrong thing. We don't want the patients to focus on the little details of how much the treatment costs. We're not trying to mislead the patients at all. We're going to tell them exactly how much it costs and how much their insurance is going to cover. But we don't want to focus on that. We want to focus on making this affordable for the patient. Using this guy is I don't care what software it comes from, Dentrix, Open Dental, SoftDent, but using this itemized printout, which is what most people do, is sucking the life out of your case presentations. So don't do it. That's a no-no. You want to use the payment options. This is your alternative. Using Payment Options 2.0, you can show the patient how to make your treatment affordable for them. I'm going to show you that in a second. The other thing that it does is it shows everybody, both the payments and your staff, exactly how patients are expected to pay in your office, and it's in writing. Very powerful. However you do your payment options, you want to make sure they're in writing. Let's make it affordable. Let's do it in writing so everybody knows. What we suggest, and what we found to be very successful, is that you offer the same three options to every patient. The details of each option may be a little bit different, but overall you're going to offer the same three options to every single patient for all treatment over, say, $400 or $500, whatever you decide. The first option is prepayment in full. That includes the insurance and the patient portion. So if it's a $1,000 case, the insurance is estimated at 50% of that. The patient's going to pay $1,000, or they're going to prepay and get a discount off of that. We recommend 10%. That's the first option. A lot of people will take you up on that. You'd be surprised how many people would like to save 10% or 5% or whatever prepayment option you decide to do. But that's on the total amount of treatment, not just the patient's estimated portion. Second option, for some people, they want to pay during treatment. Okay, that's all right. Don't take that option off the table. You'd say this is going to take about 6 appointments or 5 appointments or 3 appointments or 2 appointments, however many appointments you determine, and the patient's portion can be divided among those number of appointments. Okay. Don't forget this. The first payment is due when the first appointment is scheduled. So you're expecting the patient to pay for the first appointment before they come in for that appointment. That decreases your tendency to have failed appointments. That's your second option. Third option is some sort of an extended payment plan. Now you can do this either as an interest-free plan. These are through an outside agency such as CareCredit. Either as an interest-free plan where you pay a discount, or as an interest account, an interest payment plan, again through CareCredit, or you also get a discount, pay a discount, but it's not nearly as much. So in the case of the situation where the patient's going to pay the interest, where you're not going to do an interest-free plan, your discount with CareCredit is about 5%. And it doesn't make any difference how long the term of the payment plan is. In the case of an interest-free plan to the patient, your discount rate will be 8 to 13% roughly, depending upon the term, and I'll show you that in just a minute. But the point here is all patients get the same three options: prepayment in full, payment during treatment, or extended payment plans either with or without interest. Again, the details can vary, but we're going to present the same three options to every single patient. And it's going to look like this. This beautiful printout was actually designed for us by a graphic artist who works in marketing and advertising. Believe it or not, it's true. It's going to show those options we just talked about. Okay, the prepayment right down here, the in-office plan. In this case, I said it's going to be 6 appointments. Okay, and I divided the patient's portion by 6, did the math for you automatically. In this case, I'm showing an interest-free plan. We don't have to have that, but I said I'm going to do 24 months. Okay, that's going to cost me 11.9% for Invisalign. That's the discount to the office, but it calculates the patient's monthly payments. Or an extended payment plan. Okay, I'm going to show the extended payment plans, these two guys down here, one with interest and one without. In-office plan, which is divided by the number of appointments, or a prepayment. Everybody gets that. So if you don't want to show this, that's fine. It's going to take it out automatically for you. So how does this thing work? You can put this on your desktop so that you've got a little shortcut right there, or you can actually put it down here on the taskbar if you want. This will work on any computer. It may not work on XP, but any computer since XP, this will work just fine. It's not dependent upon your using Open Dental or Dentrix or whatever. I'm going to show you the Open Dental example here in just a second. But again, you put this on the desktop and work on as many different computers as you want to install it on. Also, you don't have to have any other software such as Excel or Microsoft Word or anything. So let's see how easily this works for our patient Mickey Mouse. Here's Mickey Mouse's treatment in here for Invisalign. In the case of Open Dental, I just go up and click on this little button right there that says Payment Options. And this opens. And now what we need to do, I've already filled it in, but fill in a brief description of the treatment plan total, any insurance coverage, and then if you're using a PPO discount, if you know what that is, you can put that amount in there. In the case of Open Dental, you can do that. In the case of other software such as Dentrix or SoftDent, you're not going to have that option. You then can look at these guys down here. You probably are not going to change these on a regular basis, but you can. In my case, I've set this up so we're going to give Mickey the choice of 6 payments in office during treatment, or in the case of Invisalign, over 6 months. That's an in-house plan. We also are going to do an extended payment plan, in this case 24 months, but you have the choice. You can use any number of months that you want to. For Invisalign, I'm willing to go 24 months, even though with Care Credit, that's going to cost me 11.9%. I can change my senior discount. I can change my prepayment discount. So in this case, I'm going to pretend that I'm using Dentrix, for example. And so I won't be able to use the PPO percentage. I'm just going to click on this second button. Now you notice I've got the same sets of buttons here and here. The difference is these buttons show an interest-free plan, interest-free to the patients. These buttons down here don't show that plan. You don't have to go over and change any of this stuff. You just leave it set as the default. So let's go click on this. This is going to show the interest-free payment plan. Boom. Does all the math for you and generates this form. So now the chair side, the front desk person, somebody can sit down very quickly and go through the payment options with the patient. The same payment options we already talked about. A prepayment for the entire amount, the insurance and the patient portion. A payment during treatment, that's the one I said was 6 months. Or an extended payment plan, either with interest down here to the patient or without interest right here. And again, does the math, shows you exactly how much the patient's payments are going to be. Now you print that out, write on this, give it to the patient, scan it in before you give it to the patient. So you know what, I don't want to give Mickey that 24-month interest-free. So I'm going to go back here. I don't have to change anything. I'm just going to go down here and click on the same place, insurance coverage, with the without the interest free. Just took that plan out. Everything else is the same. I don't have to go back and redo this thing. You don't have to have things on here, put scribble marks through them, because we're not going to do that. You know, it does it all automatically for you, instantly. What if Mickey is a senior? Okay, I can click right there, and again, this is going to be the interest-free plan. It does the senior citizen discount, whatever percentage you've decided. I said I wanted to do 10%. You want to do 8% or 5% or whatever you want to do. Does the math for you automatically. Again, what if you don't want to do the interest-free payment plan? That's fine. You just click down below. Same with cash. Same with an in-house discount plan such as QDP. It's all wrapped up in there. Again, throw away the calculator. This does everything for you and gives you a nice, neat, presentable payment options form that anyone can discuss with the patient. Let's look at another patient here, a little bit more complicated situation. This is Donald Duck, and Donald Duck has both primary and secondary insurance, and also because this is open dental, we can calculate what the PPO discount is in our office, and we want to show that to the patient whenever we can. So let's go to the payment options 2.0. I already put this information in just to save a little bit of time. So there is the total treatment plan, primary, secondary insurance. There is the discount. Just pulled it from right over there. Let me show you one other thing on here too, that when you're dealing with insurance, sometimes it's kind of nice to underestimate what the insurance will pay. Now, we're not trying to scam the patient at all. We're simply trying to underestimate what the insurance pays, so we hopefully will send a refund check to the patient, which they really like, rather than send a statement for the balance if we messed up a little bit on our insurance estimation. So what you can do right here, you don't have to, you can leave it at 100%, but let's just say I change that to 90. So what I'm going to do is underestimate the insurance by 10%. And if you look at this number down here, it's going to go from 3,000 when I hit the tab down to 2,700. Now, patient's not going to see any of this. They're just going to see this number down here. And again, we're not trying to cheat the patient. We're just trying to underestimate the insurance a little bit. In some situations, that's a valuable thing to do. So let's just leave it like that. And let's go over here. And again, we're going to do one with interest-free. In this case, I said I only want to do 12 months. And last time with Invisalign, I did 24 months. In this case, I'm going to do 12 months. So I changed that right there. I'm going to do PPO percentage because I am using open dental. Boom. There we go. And what I show the patient is this is how much you save by having the treatment done in our office. That's your PPO discount. Okay? And we've got our other payment options down here just as we did before. It did the math automatically, put that in for 12 months if I wanted to make 6 appointments or 4 appointments or whatever. Again, very quick to do. You don't have to do the math. You just make the changes and poof, they appear here. So that's Payment Options 2.0. Makes it easier to collect your fees for the patient and makes your treatment plans more affordable for patients. You're going to pay for this within 2 or 3 days of using it. Very powerful tool, works regardless of what practice management software you have, and you can use it forever.